We are going live in 5, 4, 3, 2, 1.
And Amy, you said we had a few judges that had sent their proxies in?
We did. Judge Phelps has a couple of proxies, and Judge Dial has proxy, but neither of those are here yet, so their votes don't count. There's Judge Phelps joining now. So he'll count for 3. I think we need 16, and we're sitting at about 12. And Judge Cowan out of Adair County said she would be a few minutes late because she had to attend a funeral visitation.
I'm here.
Hey, Judge Phelps, how are you?
Good. Y'all doing okay?
Good, thank you.
I have 14. You said you had how many?
I had about 12, but I could be wrong. We're trying to count, Judge, and make sure we've got a quorum here. So give us just a second and we'll get started.
Oh, no hurry. No problem.
I think that looks like a UK blanket behind you. Don't them cats play tonight?
Yeah, as in right now.
Ah, we better get this on the road.
I do have the recording on.
Do we have a motion to adjourn?
I'll second.
Okay, I'm at 15, I think.
Okay, Melanie tells me we're sitting at 15. We need one more person.
And that's counting.
That's counting the proxies that I think you have, Judge Phelps.
Yeah, and the proxy.
Are you aware that you have proxies tonight?
A lot of them.
I have a proxy for Judge Craig.
Okay, I don't have his, I don't think. Do you,
No,
Melanie?
I don't have him in there.
I tried before, didn't I? I don't know, something going on in my email. You may not have got it.
Okay.
Gail will be on there. She just texted me, want to know if I was on there. She's on her way home from the funeral home, so she'll be on in a minute, I guess.
Okay.
Okay, with Judge Craig's proxy, that puts us at 16.
Okay, I think that makes it, if you have Judge Craig's proxy there and you can forward it to me after the meeting,
Yeah.
we'll go ahead and count that one.
Yeah, yeah.
That should make
I'll send it again, but I do have it.
Okay. I think you also have Judge Smith and Judge Robertson. I believe they sent that in to us here, so you're voting for them as well tonight.
I think Judge Frank give his to Judge Dial.
Yes, I believe he did. I've got one for him too, but I don't see Judge Dial on.
On the other, make it less.
Everybody's got a hot race. They've been campaigning to see.
I
what
know.
time
I
we
talked to
could.
some of them. Yeah.
Yeah, I campaigned just as long as I could before I come back to the courthouse to do this. So,
I appreciate you taking time out for us.
and we got business we got to conduct. We got to carry on with that. So, part of it.
So, Amy, do you think we are at a quorum even without Judge Cowan?
How many proxies?
I'm only counting 15, Judge Kelly. Why don't we have Melanie do a roll call and do it that way and make sure, and that'll give Gail time maybe to get on, Judge Cowan time to get on also. Can we do that?
Sure, go ahead, do that if you would, Melanie.
Okay. I'm gonna skip the people I know aren't there. Dr. Brown? Okay, I know you'll be there. Judge Craig will be there for proxy. Dr. Drake?
Here.
Judge Frank, he's at the proxy. Gina Good?
Here.
Judge Green?
Here.
Patty Gwynn? Matt Jackson? Okay, Judge Kelly?
Here.
No, you're there. Tank Lawson?
Here.
Okay. Dr. Lee?
Here.
Okay. Dr. McKinley?
Here.
Dr. Miles?
Here.
Dr. Perkins?
Here.
Judge Phelps?
Here,
Dr. Phillips?
Here.
Dr. Richardson?
Here.
Judge Robertson's a proxy. Joe Silvers? Okay, Judge Smith is a proxy. Jake Staten? And that's it.
We counted 15.
Yeah, if Judge Dial comes, then we've got a proxy for him.
Okay.
Let me see if I've got his cell phone. Hang on, try to
Judge
find
Kelly, we have 15. We're waiting on Judge Cowan. She would make 16, and that would be a quorum, or Judge Dial, who has his vote and a proxy vote.
Okay, well, we've heard that Judge Cowan is en route, so let's give her a couple minutes here. Apologize to everybody that is here and accounted for on time, but I know Judge Cowan had a funeral visitation and she was trying her best to get back.
Judge Cowan says she's 3 miles from the house, so hopefully in about 5 minutes she'll be on here. We need to tell her not to be texting and driving.
Let me ask a question of some of you that are more knowledgeable about parliamentary procedure than I am. When I became director last fall, I took a parliamentary Robert's Rules of Order class, I guess, to try to learn more about how to handle these meetings. And I could have sworn that the instructor of that class told me that if there's not a quorum present, you can go ahead and have the meeting as long as no business is conducted. That you could share information, but you can't conduct business or hold votes. Is that correct?
That's correct. I mean, you can, do informational things, but like I said, anything that requires action, such as a vote, you can't do that unless you have quorum.
Okay, that's what I thought. I said that on one of our local board meetings, I think, earlier this month, and I don't remember who said no, they didn't think that was accurate, so I backed off because I wasn't positive, but I thought you all have a lot of years of experience in this field, so I'm sure somebody here could correct me if I was wrong.
And Amy, technically, approval of minutes, historically, we've always taken a vote on them, but they don't technically require a vote. If there's no additions or deletions, they can be approved as read without a vote.
Chair can approve that, I believe.
Okay, Ron,
Pardon
go
me?
ahead and present.
We didn't hear you, Judge Phelps. What did you say?
I said, that as long as there's no additions, deletions, or corrections, I think the chair can order that they stand as presented.
Okay. And I think we could go ahead because the only thing we'll need a vote on would be if we do any kind of creation of public health award, or when we get down to policy reviews and some things like that. So these first couple of items, we may be able to go ahead and proceed with until Judge Cowan gets here.
Okay, well, I'll vote for, let's go ahead and call this meeting to order then. If you don't mind, let me open this up in a word of prayer to start our meeting. If everybody please bow. Father God, we love you. We just thank you for the opportunity, Lord, to serve. This is a big responsibility to guide and direct our district board of health. And Lord, we're making decisions that affect a lot of people, Lord. And we just ask for your wisdom in doing this. Just ask for your guidance, Lord. Just be present in this meeting, and we just pray, Lord, that we would honor you with our decisions and our choices here tonight. We ask this tonight in Jesus' name, amen.
Amen.
So we do have minutes. You all received a copy of the minutes. If there are no additions or deletions to the minutes as presented, I'll give you an opportunity to state those if you have them.
I move that
Good to me.
If there's no additions or deletions, we will just approve the minutes as presented then and move on to the next item of business, which would be the introduction of new members. And I was told we have only one new member present tonight, and longtime friend of mine and pleasure to have back on the board, Dr. Drake. He's no stranger to the Board of Health, but I guess he's had a little time off and now he's back with us. So welcome, Dr. Drake. It's good to have you back on board.
Thanks, sir.
Okay.
Judge Kelly, I found in some of Sean's papers an oath that is supposed to be administered, I think, and I have a feeling this is just a Sean Crabtree thing. I don't really think this is a statute or anything that we have to do, but if you want me to administer that to Dr. Drake, I'm more than happy to do so.
Well, I'm not sure what the statutes require, but if we need to do that, I can go to his office tomorrow or whenever.
I think it's something that Sean just did, but if Dr. Drake is willing, we'll just have you raise your hand and I'll read this, and this can, I think, count for what it is, in case it does need to be done. All right, so the oath says, do you solemnly swear to uphold the mission of the Lake Cumberland District Health Department to prevent illness and injury, promote good health practices, and assure a safe environment to the best of your ability with honesty, integrity, and enthusiasm?
I do.
Okay, congratulations.
On it.
Did I mute everything when I mute mine?
Mhm.
Okay, so we can move on to old business then. Let me ask the board if there's anything that the administration failed to adequately follow up on from the last meeting. Seeing there's no items there, we will move on, and we're going to talk about the creation of a public health award in memory of Dr. Hossein Falazadeh. Amy, you want to discuss that?
I will, yes.
I
This
see
is
that
very
Judge Cowan
exciting for
has
me.
joined us.
Yes, she's here now. I see her name. So we should have official quorum now. I just wanted to say that at the last board meeting in December, I believe it was Judge Phelps that mentioned to me, or mentioned to the group, that he thought it would be a good idea that we look into creation of an award in honor of Dr. Flauzaday, who had served this board for numerous years. In fact, I've gone back through old minutes and tried to find exactly how many years he has served, and I haven't been able to find his original start date. So it's a very long tenure that he enjoyed on this board. So I had spoken with the director at Lexington Fayette because they have an award that they present every year, and it's in honor of Dr. Rice Leach, who was their commissioner for a long time and passed away. So I thought maybe we could pattern ours if we decided to go this route after that award that's already in place and kind of has criteria already developed and all that. So I have included in your packet the email that I shared with the board or the commissioner and the people up at Lexington Fayette about how the criteria and the selection process and things that they use for their award. So that should be right after your minutes in your packet. It's just a simple email that I've gotten, but the award would be for individuals who have demonstrated dedication to improving the health of this one said Lexington residents, so we would adapt that for Lake Cumberland residents. And then, of course, health department staff would not be eligible for the award. Criteria for selection of the award could include exemplary leadership and diligence in promoting public health, remarkable contributions and support in fostering public health programs, and work or actions that have impacted the community's health in a positive way. So what they do is they open up for nominations, they have an online submission process, and then they have a board of people that they choose to be critiques or judges or whatever of the submissions, and then they announce their winners as part of National Public Health Week in April every year. So that timeline, I don't think will work for us for this year because that only gives us about a month or so to get this in the works and underway. But I think if the board wanted to pursue this, I would be willing to try to get everything in place, and we could proceed then at the next board meeting with the official adoption of this. If you just want me to go ahead and kind of do this, I will mention that I spoke with Dr. Flauzaday's daughter this week about this, or last week, I forget when the date was, about this, and to make sure that they would not object to us using his name and doing this in his honor. And of course she said no, and she had happy tears and joyful response, and was very thankful that the board even considered this as an option. So if this is something the board wants to pursue and continue, I will continue working on this project and report back to the board next board meeting in June with the status of it. And we should be ready at that point in time, I think, to open up for submissions. If you all want to change anything or appoint people to assist me with this project or to work on it, to develop the project, I'm willing to do that, or I don't care to continue working on it on my own. But that's just the status of it. Since it was asked of me last time to pursue and to look into, that's what I have found out. So whatever the board wishes to do, I will be happy to continue, or whatever how you'll want to proceed.
We would entertain a motion to let Amy proceed with this award for Dr. Flauzaday.
I would make a motion that Amy does this and report back to us at the next meeting and honor my old buddy, Dr. Flauzaday.
I second it.
We have a motion and a second. I'm not sure who made the second.
Marlene Richardson.
Okay, Dr. Richardson. So is there any further discussion? All in favor?
I would say,
Oh, I'm sorry.
excuse me, I would say clearly Dr. Flauzaday would be the first recipient of this award. I think that almost goes without saying. And therefore, that could actually expedite this, just to mention that.
We could definitely do that. That would be a big honor for him and a great recognition, and that would make it much easier that we could do that possibly in conjunction with National Public Health Week in April. Or we also have I was going to mention this later on in my comments, but I'll go ahead and mention now, we have a 40th anniversary as a district coming up in July. So that's another option that we have too, proceeding forward on our timeline, of things that we could do. But I can certainly try to make something happen by the 1st of April, if that's the wishes of the board. And I think that's a great tribute.
I think we should add that to the motion.
I'll second that amendment.
So we have an amended motion. I guess Dr. Miles made the motion. And Dr. Richardson seconded, correct?
Mhm.
Any further discussion? All in favor?
Aye.
Are there any opposed? Okay. That motion carries. It's quite an honor to be able to have served with him. So I'm glad to see this happen. Okay, next then will be we'll move on to resource stewardship. We've got a financial update and our director's comments with Ron and Amy.
I'm gonna go ahead and let Ron share the financial statement with you all. He's got the screen pulled up on his computer and can share that and talk about that a little bit. And then I'll give you my comments afterwards.
Hello, everyone. Can everybody see my screen? Okay.
Yeah.
I'll be presenting through January 31st, 22, the financials of Lake Cumberland District Health Department. We don't have the financial information available yet to go through February. We normally aren't able to close until at least the 8th or the 9th of the following month. So that'll be available in about another week or so. So through January 31st, 2022, the balance sheet showed $12,223,721 in assets, with $91,215 of current liabilities. The total of the Lake Cumberland District Health Department's assets is equal to over 6 months of the average expenses. That was always the goal that we have, to have a running cash flow total to be able to cover over 6 months of costs. It's a good total to have. We had the district had $9,400,733 in year-to-date revenues through January 31st, and $9,594,096 in year-to-date expenditures, resulting in a $193,364 year-to-date deficit. Our annual revenues and expenses are less than budgeted, mainly due to it's kind of a flaw compared to budget. The state had encouraged us to over budget to pull down COVID-19 revenues. So it's really not that we're really over budget. It's just that they made us kind of over budget our categories to make sure that we were allocated enough money in case we needed it for COVID. And sure enough, it turned out we did. So it was good that we did that. So that's the main reason. It's really not that we're that far off the pace in budget. It's so much as the state kind of required us to do that when we were doing budget last year. Another thing is a couple of our other programs are taking off, which will allow us to have more revenues and catch up the second half of this year, like our Go 365 program, and things like that should generate a big chunk of revenue for us. I do want to note, and I usually leave this note every time we do the financials, that Department of Public Health and State is 6 quarters behind on billing us for their Medicaid match. If you remember, sometimes they're 4 quarters and sometimes they're 5. Well, now they're 6. They are so far behind up there and they can't get caught up. So that's good and that's bad. It's good in the fact that we don't have to pay them our cash. It's good that eventually they're going to come, or it's bad that they're eventually going to come calling for it. So we estimate that we approximately owe them $300,000. We certainly have the funds to cover that whenever they do. It's certainly a lot, and we'd be just fine if we had to pay that out. But we are estimating that $300,000 is now due back, 6 quarters behind, owed to them for those services. We now plan on ending the year at a $1,207,674 surplus. That is based on current standing. I do believe that is going to go up if we stay on the current COVID trend of funds, which my guess is we will plan on probably pulling down more COVID funds through June. Can't say yet what's going to happen post-June. So I am going to say that a more realistic picture is probably somewhere north of 1.4 million. But if everything stayed the same today, it would be a $1,207,674 surplus, which is a good surplus for the health department. I'm not going to spend a lot of time on the remaining. That was the main piece. Here's the next page is just a summary of the breakdown between each fee that each revenue piece that we get from state, federal, and local, and each individual expense category. You guys have that in your packets. If you have any questions, you can ask me about those. But that just reflects the breakdown I just gave you to lead to the current deficit we have. If you're wondering how, once again, I'm projecting a surplus whenever we have a current deficit, do remember we're cash basis. A good chunk of our funds are going to come in the second half of the year. We will receive about 3.2 million in revenues almost in 1 month, roughly in April and May, due to our second half of our local tax fees that we get from the 2.8% district fees that we get from the locals. And then, of course, also comprised of the retirement subsidy that we get from the state to help cover our retirement. So a bunch of that will come in post-April. So we're sitting just fine at a deficit here. On page 3 of 18 of your financials, this shows you just more of a breakdown once again of your revenue, and like kind of in a graph form, broken down by category. We do have a lot of categories. As you can see, we're trying to fit a lot on there for revenue, for breakdown of that for year to date of actual to budget. And the same thing for your expenditures on page 4 of 18. Page 5 of 18 once again shows you a breakdown of our balance sheet that I just went over to you, that I just went over with you for the breakdown of our cash and liabilities that I already read to you. I did want you to see this, because I'm guessing y'all may have seen this when you saw the packets. So our current year-to-date actual versus our prior year-to-date actual shows that we're actually 1.3 million off the pace, which I know sounds a little scary, but that's actually not. That's actually okay. If you remember last year, we ended at about a $2.9 million surplus. Right now, I told you we're probably going to end up at about a 1.4. So as you can see, the difference there's about 1.5. That's about where we're at. So actually, we're actually not far off our pace. The reason we once again received so much last year because everything was COVID. So every program we had got replaced with dollar for dollar reimbursement, allowed us more money to have last year. And like I said, we're still doing really good this year for that. But yeah, we never anticipated to receive as much as we did last year. And so that's why there's a difference in that this year. But like I said, we plan on ending just fine.
Ron, I have a question if I can interrupt. Just
Sure.
looking at the assets there on page 5 of 18, their taxing district is disproportionately higher than all the other counties. Is there a reason that they are 32,904 and the rest of them are no more than 3?
Well, that's probably just timing of cost. If I recall, Adair is in the midst of doing a flooring project, if I recall. So the other people could be doing it here in the near future, but we may have not been able. It may not have been spent yet. So if that happens, that will get spent as well. I think I want to say Pulaski is going to possibly be doing some things that they're building here in the future. So if they would have already done them post January, theirs will be a liability. All this is just showing how much is going to be getting billed back to us, or that we're going to be receiving from them when we bill them back in May and December. This is cost that we're paying for them. So Adair, I believe, has done a flooring project, if I recall, and that's accounting for their big chunking costs they're going to have back for us.
Okay. Thank
So
you.
that 32,000 you're saying, Ron, then is something that the district paid on behalf of Adair County, and then
Yes.
they'll be paying that back to us with their second payment.
Yes. So if y'all remember, all these counties represent. We have the very good benefit of having enough cash to allow coverage for each of our local health departments throughout the year, and we bill them back twice a year. We bill them back once in roughly November, December for the first half of their fees, which zeroes out all these numbers you're seeing here on these district fees. And then, of course, these build up again starting in January 1st, all the way until we bill them again somewhere around the first couple weeks of June to pay that back too. So we cover their costs for most of the year, and then we ask them to pay us all that back twice a year, along with their district management fee. So that just all that represents is we have covered $32,000 in cost for them, and most of that is representing flooring that we've covered for them, and now they owe that back to us, and they'll pay that back to us, like I said, around May or early June.
Okay. Thank you.
Sure. Okay, moving on. I won't spend a lot of time here. You'll see a lot of the fees tracked well with what we did last year for all the year-to-date services we've done. mainly because COVID was still here. So we didn't get to do a lot last year. We didn't get to do a lot again this year. So as you can see, they're all pretty close. So the numbers are very close to last year on all the clinic service we did, the amount of patients we've had, the amount of the amount of laboratory services and everything like that. So like I said, if you have any more questions about that, you can let me know, but all those are pretty same. So there's not much there's not much to highlight there. This is the year-to-date trending analysis. That it's the same information that you get every month. We just want y'all to stay updated on that for the fiscal year trending over the past 16 years, how we finished in services. Once again, this is the more detailed report of the breakdown by cost center. I don't think Sean ever went through this. I don't plan to. This just shows you how we got to the total of the deficit I've already reported to you in the revenue and expense categories, broken down by cost center for each category and every cost center that we operate out of. So if you guys have, like I said, have any questions about that, whether on this meeting or after, I'll be happy to address those. But that'll be for y'all to view. This is one that I definitely don't, that me and Sean definitely didn't spend a lot of time on. It's something that I think was requested by the board many years ago, apparently. It's just showing the actual versus earned revenue. And earned revenue, of course, is really hard to do in a health department. We don't really send out bills for our receipts. So it's kind of hard to estimate this, but based on this, it's showing that technically we have $703,000 left to receive, which is a good thing. That's just a comparison of showing how much that we have that is coming down the pipeline. And then this earned revenue sheet on the next page here is showing you how we determined the earned revenue that you just saw on that page, and it's broken down by cost center there. It's really detailed. So like I said, if y'all can analyze that, if y'all have any questions about that, you can let me know. And this is the same numbers, this never changes. This is the unrestricted reserve calculation that we did back probably in September, and the rest of the year it doesn't change. It just shows how we arrived at how we calculate our allowable unrestricted reserve at the end of fiscal year 21. And the breakdown of each cost center. The state law determines how we do that based on our fees and non-fee programs. And then this is a little breakdown of our allocations on the last page here that we have received additionally from the state post budget. So after you guys approved the budget back in last June of 2021, this is every cost center that has gone up and down that the state has either taken some money from us or they've given us money back. As you can see, they've given us additional allocations of $962,000. Some of this is a little flawed because, as you can see, there's a chunk of these that are COVID related, and some of these are just. It's not that they're giving us additional funds as much as they're just showing how much money they're reimbursing us here. It's been a little different with COVID, so a little bit of this is flawed. But this is the totality of what they've given us since July 1st of 2021, additionally, in addition to our budget funds. And I believe that is all I have for the financial report. If y'all have any questions for me, I'm here for that.
I'll go ahead. Certainly, if you have questions, you can interrupt us and continue on. But as a director, I wanted to give you my thoughts on the budget and everything as well. I do feel like we're in a really good place this year. I feel like we're on track to finish just as Ron is predicting. I've looked at these reports monthly and everything is trending very similarly to this time last year. I do expect that with COVID winding down and all of the changes that are occurring in the guidance and the decrease in cases and all that stuff, that a lot of our funding related to COVID will probably dry up and disappear. So we will be able to, and thankfully so, mercifully get back to our more of our regular services. We've not stopped our regular services during COVID. Everything has continued on, but at a reduced pace because COVID has taken priority for so long now. So now that we're able to move beyond that a little bit, some of our billable services and things will start increasing again. Of course, we're going to be 2 years behind on some of these things, trying to get things back on track and build programs back to where they were pre-COVID. So it's going to take some time to restore some of this to the level and the capacity that we were at before COVID. So patience is going to be key. I met with the hands department today, for instance, and that's one of our bigger programs as far as home visiting and prenatal and care for newborns and that kind of thing, new families. And they're probably about a third decreased in their capacity, their caseloads and different things from where they were pre-COVID. So the fact that they've been able to manage about two-thirds of their load over these last 2 years virtually has been a good thing, but they have a lot of room to grow and to grow that program. And that program is one of our more stable programs as far as funding sources and income in for the health department. So we look forward to the opportunity to get these programs back where they should be. One of the most sad things I think that I've seen in this financial statement, I'll have to show you all, and you all probably noticed it as well, but on page 8 of 18, in the packet that Ron shared, where you have the chart going down, the duplicated services, unduplicated patients, and total services, you can see how our services have declined over the years. And that's almost heartbreaking to me, but then that's also a good thing because it corresponds with the CARE Act that was passed, where patients got insurance and started having insurance. So the health department wasn't the safety net that it needed to be, that it had been previously. So some of our services did decrease. Some of our clinic things that we typically had done, that has gone down. But the fact that we're still here and still able to act as a safety net for people in our communities who need us, that's the part that's important to me. And that's the part that I want to make sure never goes away and that we continue to grow. So I'll just point that out. And if you all have questions about the financial report, Ron is certainly able to answer those more in detail than I am. I will tell you that also from a director's point of view, and I know that, we come to you all a lot as a board with problems that we have as far as retention of staff and recruitment of staff and salary issues and things like that. It's becoming increasingly difficult to recruit and retain staff at the pay rates that we have. So what I'm trying to do is to develop some sort of a strategic plan that I can propose to you all or bring to you all that has some sort of I won't say a fix, but some sort of a compromise or something that we can do, because we have open positions that we've had for months. And a couple of them that we've recently been able to fill in environmental had been open for 2 years because we couldn't find staff or people that would accept the pay. It wasn't that we couldn't find people that were qualified. It was that we couldn't find people that were qualified that would come to work for us for the amount we were able to pay. So I'm trying to develop some strategic plans, some different thoughts. I'm trying to think outside the box and some different solutions and proposals to you all that may be able to help us with some of these situations. It's not easy. There's not a quick fix, and there's not a panacea, that's going to fix everything. It's everything that I do or that I think of doing is a trickle effect to every other staff member that we have and every other program that we have. So just wanted to put that on your all's radar and horizon, because I think something is going to have to give eventually. We're going to have to look at something to be able to stay competitive and not even competitive. I'm not even asking to be competitive. I'm just asking if we can just do something that will keep, people in our program. I realize that we're never going to be able to pay and compensate for what private sectors are offering, and we shouldn't have to. I mean, we do have good benefits and other things that draw people to us, but there is definitely some room for some growth there and some opportunities that need to be explored. So that's what I'm doing now. I hope to have more for you by the time we do our plan and budget, that things that may work or may not work. Like I said, there's no quick fix, and anything that I propose would probably end up being, a recurring cost. So we also have to think about that to the bottom line for the health department. So I'm not asking any kind of decisions to be made tonight, and I'm not saying that I'll even have an answer for the next time when we do have plan and budget, but that's where I'm looking, because I know that it's killing our staff and our programs. Some of the main things that I hear is that morale is low. People that are here are having to do more and more because we can't keep people in positions to spread the workload evenly. So I am looking at options for how we can remedy that.
Amy, let me, if I can, I'd like to make a suggestion as you're thinking about this. Is first of all, let's compare our district with all the other districts around the state, but let's look regionally too, in the like Southeast region. That's let's see how we compare with, people in Tennessee and Georgia and things like the other districts. And just see, because if we're that far below everybody, then we need to be with everybody. But if it's more of a regional problem and not necessarily a district problem, we may need to find other ways of approaching this.
Right, and I certainly am. I'm starting to have these discussions with the other directors across the state, other district directors and other independent health department directors, and just seeing what their options are, what they're doing, how they're handling it. And it's not a unique problem to Lake Cumberland. It is a statewide problem. It is a problem where compensation rates and things for the state health department employees haven't changed in 30 years. We as a local board, you all are very generous and have given us annual increments for our staff over the last few years, and that helps some. But you all know that the cost of living, the 5% raises that we've been giving our staff, and you all have been able to give those to some of your staff even at the county levels. That isn't even covering the rate of inflation these days. That's not even enough to maintain where it's at, much less actually get them ahead in a lot of situations. So I am certainly having those discussions, Judge Kelly, with the other directors here in the state, and I will reach out to Tennessee and to some of our other partners in the region and see. It isn't really fair to compare like our employees to the hospital employees, because that's apples to oranges. That's private versus public and that kind of thing. So what I'm really trying to do is find out the situation in other health departments, because I think that's truly apples to apples at that point. And
probably NALBO should be able to maybe provide some statistics, across the nation. Of course, we can't really compare with New York and Chicago and Los Angeles, things like that. But we can be regional in our approach and try to make sure that we are at least competitive across the region.
Yes, and I just got those connections made with NALBO last week, so that's also on my radar, and I'm looking to them for some guidance as well. So yes, thank you for the information, and I'm right along those same lines with you. I'm trying to get all those ducks in a row and make sure I present the most accurate information to you.
Okay, well, I realize it's, workforce in general is a global problem right now, or at least a national problem. It's very hard nationally to fill positions, and I think that has a lot to do with some of the safety nets that we've got in place to keep people from being, that are incentivizing people not to work. And I think we've got a real problem nationally. I don't think it's just here.
Amy, I comment, there is some legislation going through to help with loan forgiveness and payment for people involved in the healthcare system, not just nursing, but other positions as well. So if that goes through, that may be of some aid. I think the other thing is Alabama has a thing called the Black Lands Program, where they actually mentor kids from high school through college and keep in touch with them and keep people talking to them, particularly for primary care, family medicine. But you can do the same thing for nursing. You can do the same thing for health department positions, and maybe the statewide health department can kind of look into a program like that. Because one of the advantages is, if you're from one of these 10 counties, a lot of the kids would like to stay home, and yet when they get a degree, they can't utilize that. So if we can emphasize to them, your degree can get you this job in your local health county, in Pulaski or Russell or Dare or Taylor, that's an advantage there. So there may be some advantage when this legislation comes through, but maybe we can look into statewide, looking into a program like that, the mentors. We're certainly looking to do that in family medicine, get loan forgiveness and try to mentor some of these young people and get them to go in primary care. Even though it may pay less, you can work at home, and it's fulfilling, and some people still care about that nowadays. Not all of them, but some of them still care about that. So
that's true. And we have an employee newsletter called our District Voice that we share with our staff. And so that has been mentioned. The loan forgiveness program for nursing and some of those things have been mentioned and shared, those resources out with our employees to try to help them through this. And also, just as an aside note, I'm going to be signing on behalf of the health department an agreement with Lindsey Wilson College the 1st of March, I think it's next week actually, to do something with their nursing program. And I don't have all the details. Laura Woodrum, I think, is on here. She's our director of nursing, and she was on the meeting with me. So she has more details probably, and I may get this wrong, but it's a tuition reduction program. So there's no cost to the health department. It's just a partnership, and basically we allow them to recruit from our staff. You know, they are allowed to share information about their programs with our staff and that kind of thing. So it's a win-win. There's no downside for the health department. It's just a bonus or a benefit that if any of our staff are interested in the programs that they're offering this in, it's a tuition reduction. So it's not free tuition, but it's a reduced rate tuition. And so since there's such a limited amount of things I can do as far as incentives for my staff and boost morale and everything, I thought this is at least one thing I can do. And the program at Lindsey Wilson is actually really spectacular in the fact that it doesn't just apply to our staff, it also applies to their families. So any staff or their family members who want to go into these particular programs at Lindsey Wilson that they're promoting will get this tuition reduction. And it starts on day one that we sign the agreement. So, and even if the employee leaves employment with us and goes out to find a different job or whatever, they've told me that this offer stays with that employee and that person. So it's not something that they take away. So I'm always looking for options like that and ways to benefit our staff and our employees in any way that I can. But that's something that just came up and was offered to us, and I don't see a downside. I've looked at this in multiple different ways, and there's no downside that I can find for the health department. It's only positive. So I plan to sign that agreement with Lindsey next week. And there may be other colleges that do something similar, and I'm certainly, willing to entertain that as well. I'm not just trying to plug Lindsey Wilson. I'm open for anybody that wants to give us some kind of benefits for our staff, for sure.
Right. Anybody have any questions for Amy? Is that the end of your director's report then?
I think so, yes, sir. The next item on the agenda is grants report, if no one has questions, and that's from Carol, and she's not here tonight. She had a family emergency today and couldn't attend. So the only thing that I know about the grants report, it was very unexpected, and she didn't have her things to me to report on her behalf. But the only thing I know is that the Heart for Change grant, and I think Jamie Lee is over that grant. She's on with us tonight too. If she wants to add anything, she can. The Heart for Change grant will be ending this spring. I don't know if it's April or May, but it's coming up pretty quick. And then that's the only thing I think that's really gonna be affecting anything before the next board meeting. So that small grant that we've had to do that wellness program with some of the churches in our area and different activities, that will be ending, I think. Did I misinterpret anything, Jamie? You may not be able to unmute.
No, you covered it. It ends April the 30th.
Okay.
Okay.
That's it as far as old grants that we have. Of course, we're pursuing new grants all the time. There's several things on the horizon, and I don't know exactly what's in the works for sure, but I know that a lot of department heads are looking at different things, and usually I find out about them toward the end of the process when they're getting ready to sign off and submit. So I know that there's always something continually in the works for grant submissions.
Okay. All right. Well, we'll move on then to the budget review committee. I need to assign that. Now, if you can refresh my memory, I believe we had 5 on the review committee previously. Is that correct?
Yes, that is correct. And it's usually it's been in the past, it's been our executive committee, the ones that serve on that. It doesn't have to be. If you want to appoint different people, that's certainly fine too. But that's how we had done it in the past, I think.
Okay. Now, do you have the executive committee members' names?
I don't right in front of me. I meant to pull that out, but it was yourself, Dr. Falazade, Dr. Miles, I think. Were you on it, Dr. Miles? I may have.
I think he was. I think Marlene was on that maybe, and Judge Phelps.
Yes.
Yes.
Yes, that sounds right.
So basically, we've lost Dr. Falazade. So we would, if the others are still willing to serve, and unless somebody else wants to serve, is there anybody out there that would like to be on the budget review committee?
Steve, I think I was voted last meeting to replace Dr. Falazade.
Yes, I think we did that last meeting.
I think
Okay.
that's correct.
I thought you were on the last review committee, Dr. Richardson. I'm sorry.
No,
Okay, so that gives us
I think
then.
I remember that one.
So that gives us Judge Phelps, Dr. Richardson, Dr. Miles, myself, and who is the other one? Amy?
I think I'm still on from being
Yes,
co-chair or
yes, I think you're right.
whatever I
I
am.
think you're right.
So we've got two from the medical field. We've got myself as chair, and then do we have another judge that would be willing to serve on that?
I think it was Judge Robertson. I'm trying to look back in the old minutes.
He
that we
may not be
disapproved.
interested since he's checking out now. He's resigning
Yes.
from the judgeship. So maybe if Judge Green or Judge Cowan, either one would like to step up to serve on that committee.
I don't care to.
Okay. And Judge Green, do you have any problem with Judge Cowan serving? Yeah, I would imagine not. I would imagine not. But okay, well, that would give us 5 if we want to go with that. If you all do we need to have a motion for that, or is that just an appointment?
I think that's just an appointment. I think we can just appoint them without a vote.
Okay, if any of those have any, unless you're opposed, we'll go ahead and go with the ones that were mentioned.
So that would be Judge Kelly, Dr. Phillips, Judge Phelps, Dr. Richardson, Dr. Miles, and Judge Cowan.
Any of y'all opposed to that?
No.
Sounds like a great team. Let's go with it. All right, so we'll move on then. Continuous improvement. Of course, as always, on your back of your agenda, I guess you can make any suggestions and turn those into the health department.
You certainly can. You can also text me or call me anytime. You don't have to use the formal document, the form there. That's just something that we used to do when we were in person more so, but I'm available to you all anytime you have suggestions or critiques. I'm certainly willing to listen to you all. And I know Janae's going to talk next about the board survey, and she's put a link in the chat. If you all can see the chat feature on your Zoom screen, it's not too late. We didn't have a great participation rate on the board survey, so if you haven't completed yours and you're still willing to, you can just click that link right there in the chat and do it. It's very short and sweet. We tried to switch it around this time, and it's mostly, I think, yes or no questions, and it takes a few minutes. So I would appreciate any feedback that you all have for us.
Okay. So do you want to, Janae, would you like to speak to the board survey?
That was exactly what I was going to say. And we will send it out by email again tomorrow. And we only had 9 responses. I would at least like to have feedback from at least half of the board members. So I've got the link there in the chat, and I'll ask Amy to send it out one more time in the morning. It looks like it's taken people about 6 minutes to complete it. So.
Okay. I'm probably one of the guilty ones of not responding. I'm sorry. Okay, so
I think it's an anonymous survey too, so I don't think you even have to put your name on it. And
I didn't have to tell on myself. I'm sorry.
It is completely anonymous.
I will look for the link now. I've been shamed. Okay, we'll move on then. Everybody, if you would, look for that link and try to fill out that survey, give your feedback. But we'll move on to the next thing, which is the annual EPI report with Amanda. She's with us.
She is. She got to join today. Hi, Amanda.
Hello. I think Ron is going to share my brief PowerPoint.
Yes, hang on just 1 second.
All right.
I will share that. Bear with me.
Having Amanda here to do this presentation tonight is a good sign for COVID numbers going down, because she's been buried for years under COVID. So I'm thankful to get to have her back doing some of her normal duties too.
Okay, so every year I come to you all and I give you a fiscal year report of reportable disease and outbreaks for the prior fiscal year. And I did not have this PowerPoint or the data available in December, so that's why it was pushed to this month. So this is for 2020, 2021 fiscal year. So when we talk about reportable diseases, there are certain reportable diseases that CDC has laid out that we must investigate and we must report. And not everything always meets the CDC's criteria. So when looking at reportable diseases, they must have a lab or clinical criteria to be determined a case. Labs and reports that don't meet the case definition, we still spend time in investigate those to see if they do meet case definition. So the following report is only those that do meet the CDC case definition. So there are hundreds more that are investigated that may not be reported in this report because they did not meet the case definition. Next slide. And again, this is for our fiscal year 2020 to 2021. So this graph, it shows you, or this image shows you all reportable diseases on the left of your screen. It says the condition name, and then across the top is the counties, and then to the far right is the total. I'm not going to go in depth at these, but you can kind of see what is reportable in the state of Kentucky. We did have a total of 3,797. That is definitely more than normal. But you can see COVID-19 was 3,767 of those. Next slide. Every year I tell you all what was the top 3 diseases that had our highest case count. For this fiscal year, it was 2019 novel coronavirus. Again, that was 3,767 cases. Campy, we had 5, and HIV, we had 4. The previous fiscal year, the top 3 was COVID-19, hepatitis A, and salmonella. So COVID was still the same, but there was a change with Campy and HIV for this past fiscal year. Next slide. I also usually tell you our outbreaks for the fiscal year. This is the first year in 9 years that I've been here as an epi that we have not had individual outbreaks. So this is very unusual. In the past, this past fiscal year prior to this, we had 10 outbreaks. They are normally like norovirus, influenza, salmonella. But again, for this past fiscal year, we had no individual outbreaks. We did, of course, deal with the COVID-19 pandemic, but as far as individual outbreaks, there were none, which is very interesting. That is the end of my report. If you all have any questions, I will take those.
All right. Well, thank you, Amanda. If there's no questions, we'll move on to our partner engagement. We've got the harm reduction and syringe exchange updates with Laura and Tracy.
Hello. We are continuing our harm reduction program and syringe exchange program in 5 of our 10 counties that have been approved. The UK staff that are housed in our health departments are largely taking care of those services. They've also been able to expand to offer some additional HIV testing. They've got a couple of events scheduled in April, and they're going to take our mobile unit out and do some testing and things in the community. So that's going good, and I expect we'll do some more of that as the weather warms up.
Anybody have questions? Our next item then is our oversight, but of course Carol is out. So Amy, do you have anything to report for the oversight? The human resources report?
I have just the total number of new people that came on duty and those who went off, just the normal HR report that she gives. We've had 4 staff members, new staff members that have come on duty. 2 of those are contact tracers, 1 new environmentalist that's going to be in Casey County. And then we had a new HR administrative specialist that has been hired to help with the load in the HR department. And then we had 10 staff who have gone off duty. So we had 4 that came on, but 10 that have left. 1, 2, 3, 4, 5 of those have been contact tracers. So as COVID is winding down, some of these people are phasing out, and that's a good thing. And then we have had four hands staff to leave, and one janitor has left employment. So we are, as I said earlier, we are having a hard time keeping people in some of these positions, and the turnover has been a little more so than normal of late. So.
Okay. All right, anybody have questions regarding HR report? If not, we'll move on to policy development, and we'll talk about the annual review of policies. Amy?
Okay, so I shared out with the board packet. There was 2 emails I sent last week. One was the board packet, and then the second email was about policy reviews and revisions. At this time of year, every calendar year, our executive team members look over all of the policies that fall under their purview and try to make any adjustments or revisions or suggestions for changes that need to be made, updates, that kind of thing. So that was all sent out to you all for you to review ahead of time. I did have a few comments back on a couple of our policies, so I wanted to bring those up and just let you know that some of these things had maybe been modified since the version that you received. The breast pump policy, the wording of that was a little awkward and unwieldy, so that has been changed to simplify the wording. It didn't change the content of the policy at all. It just changed some of the grammar. Also, the employee manual, where we list the vaccines that are recommendations or requirements for employment, there's part of that was actually vaccines and part of that was testing. So we have labeled that out clearly now to differentiate between what is medications and vaccines and what is tests that are offered for our staff and our employees. So I didn't think that those changed the actual intent of the policy or anything that would change and make me have to resend to you all. But if you want me to resend those to you all, just so for the record, I can do that. It was mostly just grammatical formatting and that kind of thing. There was one comment about our physical distancing policy that it was unnecessary possibly, and is a common sense thing that maybe shouldn't have a policy written on. So I don't have a preference on that one way or the other. I think it is my opinion, if I remember correctly, and since Carol's not here to talk to this more directly, I think those policies related to COVID and social distancing and masking and all those things came from our OSHA templates that we got when we were scheduling and trying to do all of our OSHA requirements and things. So that's probably where that came from. I could be wrong on that, but that was my thinking along those lines. Dr. Wayman, I think, spoke to Carol about that, so she may have more to contribute as well. Dr. Perkins, I think you were the one that I had gotten feedback from on some of these policies. Did I misinterpret anything that you had given? Is that okay?
No, that's correct. If I have my microphone on now.
Yes.
Yeah, the other things didn't change the policies materially for sure. But the policy on the distancing, in my opinion, is sometimes if you say too much, you obligate yourself to things that down the road end up costing you trouble and money. And I don't think that the distancing policy is needed at all, in my opinion, unless there's some state reason that we have to have it or something like that. But you're going to do what's sensible, whatever the situation.
Well, this is Christine. We are continuing to follow the CDC guidelines. And since all our counties are still, except for one, are in the red, we haven't messed with the policies. But we have added that as soon as these counties are out of red, I'm not sure if it's orange or yellow, then we will follow the new guidelines which exist. So they can be altered just by following the guidelines, including masking, including distancing, including everything.
Yes, I agree.
That's probably a much more simpler approach to that policy. So we can just say we'll follow CDC guidelines as needed.
Okay. Do we need to move on then to new policies with Janae?
If it's okay with you, Judge, I think we need an adoption to approve the old policies as presented, and then Janae may
Okay.
have some new policies that she wanted to present, because we like to, anytime we have a review, we need to update our dates on our policies and make sure that they've been looked at and you all have actually given them consideration.
I'll make a motion to approval.
Second.
We have a motion by Judge Phelps and a second, I think, by Gail Phillips.
Yes.
Is there any further discussion? All in favor?
Aye.
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 Is there any opposed? Okay, that motion carries. Okay, so now we'll go to Janae with the new policies.
We did not have any new policies this time, just the revisions that you all just voted on, so.
Well, I thought that, Janae. I saw it on the agenda and you didn't tell me to take it off. So I thought, well, maybe I missed something.
Well, I had to look back through all those policies to make sure I didn't miss something.
Okay. All right. Well, I
Wonderful.
guess
Okay.
that's the end of our regular business meeting then. We've got to set a date for our next meeting. It would be in June. Do you have a date? We need to have that, Amy?
I'm looking at either the 14th or the 21st. It's typically the first Tuesday of the month, but in the June meeting, because it's our budget, we like to go a little bit later out so we can make sure we've gotten our allocations and been able to do all of our presentation and everything to the executive team and everyone that has had budget review prior to this full meeting. So the 14th or the 21st would be, either one of those would be good days, whatever's the pleasure of the board.
I'll be out of town the 14th.
Okay. Does the 21st sound good for most everybody? That would be the third Tuesday.
That would be good for me.
No problem.
Sounds good to me.
Okay.
Okay,
I
so let's
will,
plan on, we'll plan on the
Yeah.
21st then at 7:00 Eastern.
Yes, and hopefully we'll be in person. I'm planning to do that one in person if that's an option and we can. Back at Russell County, if that's what the board still wants to do, and since it's been a while since we've been together, we'll get to enjoy a meal maybe and see everybody face to face.
Okay, that sounds good. I've got, I guess, before we close, I need to ask Tank. Tank, what's the score?
I promise you, I've not watched a bit of it.
Oh, okay. Is anybody out here watching the game? We need a score update.
31-48
I'm
Kentucky.
giving my full attention.
What was that, Judge? Somebody
I
gave
heard
a score. I
somebody.
heard it.
48-39, UK's ahead.
All right, that sounds good. Well,
All
let's,
right.
if no further business, let's entertain a motion to adjourn.
So moved.
We have a second?
Second.
All right, all in favor?
Aye.
Any opposed? All right, well, you all have a good evening and go Cats.
Thank you.
Thanks, everyone.
Good night.